Question 1. A social worker is conducting an initial assessment with a client whose primary symptoms include persistent, intrusive thoughts about a past trauma, recurrent distressing nightmares, and hypervigilance. Which of the following conditions is most likely being assessed?
A.
Generalized anxiety disorder, GAD. B. Major depressive disorder, MDD. C. Post-traumatic stress disorder, PT. D. Adjustment disorder with anxiety. Answer: C. Post-traumatic stress disorder, PTSD. This question tests knowledge of diagnostic criteria, and the keywords intrusive thoughts, past trauma, distressing nightmares, and hypervigilance are classic symptoms of post-traumatic stress disorder. PTSD is characterized by re-experiencing the traumatic event, avoidance of associated stimuli, negative alterations in cognition/mood, and marked arousal/reactivity, which directly matches the client's presentation. GAD involves excessive worry about everyday events, while MDD focuses on persistent sadness or loss of interest, and an adjustment disorder occurs within 3 months of a stressor and is less severe than PTSD. A helpful way to remember this is that if the problem stems from a specific, life-threatening event, PTSD is the most likely diagnosis to consider first. Question 2. A social worker meets with a 45-year-old client who has recently lost his job, and the client reports feeling anxious, irritable, and has begun smoking heavily again after quitting 5 years ago. What is the social worker's first action?
A.
Explore the client's past history of job loss and unemployment. B. Develop a safety plan and assess for immediate risk of harm to self or others. C. Contact the client's primary care physician to discuss medication options for anxiety. D. Complete a detailed biopsychosocial spiritual assessment. Answer: B. Develop a safety plan and assess for immediate risk of harm to self or others. The core concept here is the priority of safety in the initial phase of social work assessment, which is always the absolute first step, regardless of the presenting problem. The keywords are first action and the client's heightened state of anxious, irritable feelings coupled with a major life stressor like job loss, which increases immediate risk. Before proceeding with a full assessment, exploring history, or considering outside consultation, the social worker must rule out the most critical risk, which is self-harm or harm to others. For instance, even a client presenting with a minor issue should be screened for suicidal ideation if they appear distressed. Remember this rule: immediate safety overrides all other assessment and intervention steps. Question 3. A social worker is preparing for an involuntary termination of services due to the client's noncompliance and repeated threats to the social worker's safety. What is the best course of action for the social worker?
A.
Terminate services immediately without notice to protect the social worker's safety. B. Provide the client with reasonable notice, clinical rationale for termination, and referrals to other providers. C. Contact the client's family to notify them of the termination and enlist their help in managing the client. D. Consult with an attorney to draft a legal document formally ending the social work relationship. Answer: B. Provide the client with reasonable notice, clinical rationale for termination, and referrals to other providers. This question addresses the ethical principle of responsible termination of services, even in challenging circumstances like safety concerns. The keyword best requires the social worker to follow ethical standards, which mandate minimizing harm to the client and facilitating continuity of care. Although safety is a concern, the social worker must still offer reasonable notice and referrals to help the client transition, documenting the threats and consulting with a supervisor for safety protocols while maintaining ethical duty. For example, the worker might send a certified letter documenting the termination date and 3 specific referrals. Always prioritize the ethical duty to the client's continuity of care while taking necessary steps for safety when terminating a professional relationship. Question 4. A client who is preparing for a major presentation at work suddenly develops a severe migraine and forgets key details about the presentation while speaking to their partner later that evening. In psychodynamic theory, This forgetfulness is an example of which defense mechanism?
A.
Regression. B. Sublimation. C. Conversion. D. Repression. Answer: D. Repression. This question tests knowledge of defense mechanisms, and the scenario points to an unconscious exclusion of painful or threatening thoughts from conscious awareness. The client forgets key details related to the stressor, the presentation, without conscious effort, which is the definition of repression, the most basic defense mechanism. Conversion would involve a physical symptom, like hysterical blindness, without a physical cause, and regression is reverting to an earlier developmental stage, neither of which fit the scenario. Consider a child who experiences an extremely traumatic event and cannot recall any details of that day years later. This is repression. When a painful memory or idea is unconsciously put out of mind, think repression. Question 5. A 78-year-old client often recounts stories from their youth with great pride and states, "I've made my peace with my past, and I wouldn't change a thing." According to Erik Erikson's stages of psychosocial development, this client is successfully navigating which crisis?
A.
Intimacy versus isolation. B. Generativity versus stagnation. C. Identity versus role confusion. D. Ego integrity versus despair. Answer: D. Ego integrity versus despair. This item tests knowledge of Erikson's final stage of psychosocial development, which applies to the elderly client population. The key clue is the client's age, 78, and their expression of life satisfaction and acceptance of their life choices, summarized by, "I've made my peace with my past." This successful reflection on one's life is the positive resolution of the crisis of ego integrity versus despair, which occurs in late adulthood. If the client were feeling regret or bitterness, they would be experiencing despair instead of integrity. Remember that the older adult years are focused on finding meaning and acceptance of one's life journey. Question 6. A social worker is using the miracle question with a client who is struggling with depression and marital conflict. This technique is most commonly associated with which therapeutic modality?
A.
Cognitive behavioral therapy, CBT. B. Psychoanalytic therapy. C. Solution-focused brief therapy, SFBT. D. Dialectical behavior therapy. Answer: C. Solution-focused brief therapy, SFBT. This question assesses knowledge of specific therapeutic techniques and the associated theoretical frameworks, identifying the miracle question as a key technique. The miracle question asks clients to imagine what life would look like if their problems were suddenly solved overnight, which is a classic tool used in solution-focused brief therapy, SFBT, to help clients envision their preferred future and identify solution-oriented goals. This technique is not a core component of CBT, psychoanalytic, or DBT, which focus on thoughts, the unconscious, or emotional regulation, respectively. For instance, the social worker might ask, "If a miracle happened tonight, what would be the first small sign tomorrow that things are better?" When you see the miracle question, you should immediately think of SFBT's focus on future solutions rather than past problems. Question 7. The primary purpose of using the Global Assessment of Functioning, GAF, scale in the DSM-4 was to
A.
Determine a client's specific psychiatric diagnosis. B. Measure the client's overall psychological, social, and occupational functioning. C. Assess the risk for suicide or homicide. D. Track the effectiveness of psychotropic medication. Answer: B. Measure the client's overall psychological, social, and occupational functioning. This question tests knowledge of outdated but historically important assessment tools like the GAF, which was included in the DSM-4 but removed from the DSM-5. The GAF was designed to provide a single, numerical rating from 0 to 100, representing a person's general level of functioning across various domains, not for diagnosis, risk assessment, or tracking medication. Clinicians used it to track a client's clinical progress throughout treatment, providing a holistic view of impairment. It is important to know this historical measure because many long-term records still contain GAF scores, even though the DSM-5 now uses other dimensional measures. Question 8. A social worker observes a 4-year-old client struggling to share toys with peers and consistently demanding to be first in line, demonstrating a strong sense of self-importance. According to Sigmund Freud's psychosexual stages, the client is experiencing fixation in which stage?
A.
Oral stage. B. Anal stage. C. Phallic stage. D. Latency stage. Answer: C. Phallic stage. This question is about Freud's psychosexual stages of development and identifying the characteristics associated with the phallic stage, ages 3 to 6. The keywords demanding to be first, strong sense of self-importance, and struggling to share align with the development of the Oedipus/Electra complex and issues of sexual identity, competition, and inflated ego that define a fixation in the phallic stage. The oral stage, infancy, is about dependency, and the anal stage, toddlerhood, is about control and compliance, neither of which match the specific presentation. A fixation at the phallic stage might lead to an overly competitive or aggressive adult personality. Question 9. In the context of the ASWB ethical standards regarding technology, a social worker's best action when communicating with clients via email is to
A.
Use a standard, non-encrypted email service as long as the client consents. B. Limit communication to scheduling appointments and administrative tasks only. C. Utilize encrypted email and obtain informed consent regarding the risks of electronic communication. D. Assume the client's personal email is secure because it requires a password. Answer: C. Utilize encrypted email and obtain informed consent regarding the risks of electronic communication. This question addresses the ethical responsibility of social workers regarding confidentiality and technology use, especially in light of the 2025 updates that emphasize digital ethics. The keyword best points to the highest ethical standard, which requires actively protecting confidentiality by using secure methods like encryption and ensuring the client understands the inherent risks of transmitting information electronically. Simply gaining consent for an unencrypted service is not sufficient because the social worker is ethically responsible for using secure platforms. For example, a social worker should use a HIPAA-compliant email system specifically designed for healthcare communication. Social workers must take proactive steps to secure all digital communications. Question 10. A client reports that they consistently transfer their feelings toward their overbearing mother onto the social worker, often reacting with defensiveness and compliance in session. The social worker recognizes this dynamic as
A.
Countertransference. B. Splitting. C. Transference. D. Resistance. Answer: C. Transference. This item tests the fundamental psychodynamic concept of transference, which is the unconscious redirection of feelings from one person like the mother to another, the social worker. The key clue is that the client is transferring their feelings toward their overbearing mother onto the social worker. Countertransference is the social worker's reaction to the client's transference, while splitting and resistance are different defense mechanisms or clinical dynamics. For example, a client who is often ignored by their father may become overly demanding of the social worker's time and attention, demonstrating transference. Always remember that transference is the client's projection of past relationships onto the social worker. Question 11. Which of the following is an example of an antagonist medication?
A.
A drug that blocks opioid receptors to prevent a euphoric high. B. A drug that mimics the effect of a neurotransmitter, activating a receptor. C. A drug that increases the reuptake of dopamine in the brain. D. A drug that primarily increases the production of serotonin. Answer:
A.
A drug that blocks opioid receptors to prevent a euphoric high. This question tests basic psychopharmacology terminology, specifically the difference between agonist and antagonist actions. An antagonist is a drug that blocks the action of an agonist, effectively preventing a natural or artificial substance from activating a receptor, which is exactly what a drug that blocks opioid receptors does. Conversely, an agonist mimics a substance or activates a receptor. For example, naloxone Narcan is an opioid antagonist used to reverse an overdose by blocking opioid receptors. When thinking of antagonists, remember the concept of blocking or stopping an action. Question 12. A social worker is conducting an assessment with a newly arrived refugee family. The mother is hesitant to share personal information and repeatedly refers to her cultural values as a reason for her reluctance. What is the social worker's next step?
A.
Continue the assessment using more direct, close-ended questions to gather necessary data. B. Acknowledge the mother's cultural values and gently inquire about her comfort level and the best way to proceed. C. Explain the legal limits of confidentiality and mandate reporting to reassure the client. D. Refer the family to a community-based organization that specializes in working with their specific culture. Answer. B. Acknowledge the mother's cultural values and gently inquire about her comfort level and the best way to proceed. This scenario addresses the critical social work value of cultural competence, and the keyword next requires a response that respects the client's expressed concerns. The mother's stated cultural values and reluctance must be acknowledged respectfully before the assessment can proceed effectively, ensuring the worker is not imposing their own cultural norms. Continuing the assessment directly or immediately referring the family disrespects their current engagement and potential ambivalence. The social worker should use empathy and open communication to foster trust, perhaps asking, "What feels safe for you to share today?" The most effective approach in cross-cultural work is always to meet the client where they are, showing respect for their self-expressed boundaries. Question 13. A client diagnosed with borderline personality disorder frequently idealizes the social worker in one session, describing them as the most helpful person ever, but then dismisses the social worker as incompetent in the next session. This behavior is a classic example of which defense mechanism?
A.
Dissociation. B. Isolation of affect. C. Splitting. D. Intellectualization. Answer. C. Splitting. This question tests knowledge of defense mechanisms particularly common in personality disorders, where splitting is a key characteristic. Splitting is the inability to integrate positive and negative qualities of oneself or others into a cohesive whole, resulting in alternating between polarized extremes of all good, idealization, and all bad, devaluation. Neither dissociation, isolation of affect, nor intellectualization captures the sudden, alternating, and extreme shifts in viewing the same person. For example, a child may view their mother as an evil witch when they are denied a request, but then see her as a perfect saint moments later. When you see extreme, alternating views of the same person, all good/all bad, think splitting. Question 14. A social worker receives a legally valid subpoena for a client's records. The social worker's first action should be to
A.
Contact the court that issued the subpoena and ask for clarification. B. Assert privilege and refuse to release the records. C. Immediately contact the client and obtain or attempt to obtain informed written consent. D. Consult with a supervisor or agency legal counsel to determine the appropriate response. Answer. C. Immediately contact the client and obtain or attempt to obtain informed written consent. This ethical decision-making question centers on the priority of the client's right to confidentiality and self-determination when a legal demand is made. The keyword first mandates that before seeking consultation or releasing information, the social worker must prioritize the client's informed consent to waive privilege or advise the client of the subpoena so they can take legal action to quash it. A subpoena is a request, not a court order signed by a judge, so a social worker cannot simply release the records or refuse without involving the client. After informing the client, the social worker should then consult with legal counsel or a supervisor. Question 15. A social worker is utilizing a technique where they relabel the client's problem behavior with a positive connotation to change the client's perception of the issue. For example, the worker calls the client's stubbornness their firm commitment to their beliefs. This technique is known as
A.
Paradoxical intention, B. Reframing, C. Interpretation, D. Confrontation. Answer: B. Reframing. This question tests knowledge of core intervention techniques, where reframing is defined as changing the conceptual or emotional setting of a situation by placing it in a new framework that fits the facts, but changes the overall meaning. The example of taking stubbornness and calling it firm commitment perfectly illustrates reframing the problem in a more positive light to enable new possibilities for change. Paradoxical intention is prescribing the symptom, and interpretation is connecting past unconscious material to the present, neither of which is the correct fit. Reframing the problem can help the client see the behavior as a strength in certain contexts, paving the way for modification. Question 16. The mesosystem, as described in Bronfenbrenner's ecological systems theory, refers to the
A.
Immediate environmental settings such as family and school. B. Interconnections between the elements of the immediate environment. C. Social structures that do not contain the individual, such as government policies. D. The historical and cultural patterns of the lifespan. Answer: B. Interconnections between the elements of the immediate environment. This question assesses knowledge of Urie Bronfenbrenner's ecological systems theory, specifically the mesosystem level. The mesosystem is defined as the system of relationships and interconnections between the various microsystems, which are the immediate environments of the individual. For example, the mesosystem would include the relationship between a child's school experience and their home life, such as parents attending school events. The microsystem is the immediate setting, while the exosystem and macrosystem are more distant forces. Here is a simple way to remember it. Micro is individual settings, and meso is the merging of the micro settings. Question 17. A social worker is assessing a 12-year-old child whose parents report a history of deliberately setting fires, destroying property, and showing a lack of remorse for hurting animals. The child is most likely presenting with symptoms that align with which DSM-5 diagnosis?
A.
Oppositional defiant disorder, ODD. B. Conduct disorder. C. Attention deficit/hyperactivity disorder, ADHD. D. Autism spectrum disorder, ASD. Answer: B. Conduct disorder. This question tests the differential diagnosis between common childhood behavioral disorders, specifically identifying the criteria for conduct disorder. The keywords deliberately setting fires, destroying property, and lack of remorse for hurting animals are hallmark criteria for conduct disorder, which involves serious violations of the rights of others and major societal rules. Oppositional defiant disorder, OD, involves an angry/irritable mood and defiant behavior, but does not include aggression toward people or animals, or destruction of property. Conduct disorder is the more severe diagnosis and may lead to antisocial personality disorder in adulthood. Question 18. A client has been prescribed an SSRI, selective serotonin reuptake inhibitor, for depression. The social worker should advise the client that the medication will typically take how long to reach full therapeutic effect.
A.
Within the first 24 to 48 hours. B. 1 to 2 weeks. C. 4 to 6 weeks. D. 2 to 3 months. Answer: C. 4 to 6 weeks. This question assesses the social worker's understanding of basic psychopharmacology, specifically the therapeutic lag time for SSRI medications commonly used for depression and anxiety. Although side effects may start immediately, the brain needs time for the neurochemical changes to occur and stabilize the mood, so the full therapeutic benefit usually requires 4 to 6 weeks of consistent use. It is essential for the social worker to prepare the client for this delay to prevent the client from prematurely discontinuing the medication, perhaps telling them, "Please continue taking this as prescribed, even if you don't feel better right away." Clients need this expectation set early to help prevent treatment non-adherence. Question 9-2. A social worker is conducting a first session with a client experiencing a sudden life crisis due to an unexpected divorce. The best focus for the social worker in this initial stage of crisis intervention is to
A.
Immediately explore the historical roots of the client's relationship problems. B. Help the client develop a detailed long-term plan for financial and housing stability. C. Work to quickly decrease distress, establish rapport, and restore the client's coping to pre-crisis level. D. Focus exclusively on the client's current emotional state and avoid discussing the stressor itself. Answer: C. Work to quickly decrease distress, establish rapport, and restore the client's coping to pre-crisis level. This question addresses the primary goals and focus of crisis intervention, and the keyword best requires the most accurate, immediate goal. Crisis intervention is brief and focuses on the present, aiming to quickly stabilize the client, decrease their acute distress, and restore immediate functional coping. Long-term planning or exploring history are not primary goals of the initial crisis work, which is focused on mitigation and stabilization. The most immediate priority is to ensure the client is safe and supported enough to regain a sense of control and equilibrium. Question 20. A social worker is facilitating a closed, voluntary group for individuals coping with grief. During the group's second meeting, several members begin to challenge the social worker's leadership, question the group's rules, and express frustration with the lack of immediate progress. According to Tuckman's stages of group development, the group is currently in which stage?
A.
Forming. B. Norming. C. Performing. D. Storming. Answer: D. Storming. This item tests the social worker's knowledge of the stages of group development, popularized by Bruce Tuckman's model. The keywords challenge the social worker's leadership, question the group's rules, and express frustration are defining characteristics of the storming stage, where conflict and resistance emerge as members begin to assert themselves. The forming stage is characterized by initial politeness and dependence on the leader, while the norming and performing stages involve cohesion and task focus, respectively. This period of conflict is a normal and necessary stage for the group to establish its power dynamics and expectations. Question 21. A client is concerned that the social worker is sharing their personal information with the social worker's colleagues. The social worker explains that client information is shared with supervisors and other staff for the sole purpose of ensuring the highest quality of care. This practice falls under the ethical principle of
A.
Self-determination. B. Informed consent. C. Absolute confidentiality. D. Limits of confidentiality. Answer: D. Limits of confidentiality. This question is about the boundaries of the ethical principle of confidentiality in a professional setting. The explanation that information is shared with supervisors and staff for the purpose of ensuring high-quality care describes the common, necessary, and ethically permissible limits of confidentiality that clients must be informed about. Absolute confidentiality rarely exists in practice because of these internal needs for supervision, as well as mandated reporting requirements. While informed consent covers the client agreeing to these limits, the reason the information can be shared with a team is defined by the limits of confidentiality. Question 22. A client insists that the social worker, who has a master's degree in social work, MSW, is responsible for prescribing a medication the client believes will cure their anxiety disorder. The social worker's ethical and professional response is to
A.
Educate the client about the social worker's scope of practice and offer a referral for a psychiatric evaluation. B. Agree to contact the client's physician to request the medication the client is seeking. C. Terminate services due to the client's inappropriate expectations. D. Begin psychoeducation on medication side effects to manage the client's expectations. Answer:
A.
Educate the client about the social worker's scope of practice and offer a referral for a psychiatric evaluation. This scenario tests the critical ethical concept of scope of practice and the social worker's duty to provide competent care. The social worker must clearly and professionally educate the client that prescribing medication falls outside the social work scope of practice, and then provide a referral to a qualified professional, like a psychiatrist or primary care physician. Terminating services is too extreme, and contacting the physician on the client's behalf does not address the client's misconception about the social worker's role. A social worker's primary ethical duty is always to practice within the boundaries of their competence and license. Question 23. A social worker is conducting a psychosocial assessment and asks the client to list several pros and cons of changing their current employment situation. This specific technique is most aligned with which stage of the change process according to the trans-theoretical model, TTM?
A.
Pre-contemplation. B. Contemplation. C. Preparation. D. Maintenance. Answer. B. Contemplation. This question tests knowledge of the trans-theoretical model, TTM, which describes the stages of behavior change. Asking the client to list pros and cons, known as decisional balance, is a core technique used in the contemplation stage, where the client is aware a problem exists and is thinking about change, weighing the benefits against the costs. In the pre-contemplation stage, the client is unaware of or unwilling to change, while preparation involves active planning. When a client is debating a change and weighing the good and bad, they are firmly in the contemplation stage. Question 24. A client reports a pattern of engaging in promiscuous sexual behavior, shoplifting, and reckless driving, describing these behaviors as exciting and acceptable parts of their life that do not cause them distress. This collection of behaviors is best described as
A.
Ego-dystonic, B. Ego-syntonic, C. Intellectualized, D. Dissociative. Answer. B. Ego-syntonic. This question requires distinguishing between ego-syntonic and ego-dystonic, which is crucial for personality and behavioral assessments. Ego-syntonic refers to behaviors, values, and feelings that are in harmony with or acceptable to the needs and goals of the ego or conscience, meaning the client views them as normal and acceptable. The client reporting that the behaviors are exciting and acceptable and cause no distress is the definition of ego-syntonic. Ego-dystonic behaviors are those the client finds distressing and inconsistent with their self-image. Most personality disorders, for example, involve ego-syntonic traits. Question 25. What is the most likely side effect a social worker should monitor for in a school-aged child prescribed a stimulant medication for attention deficit/hyperactivity disorder, ADHD?
A.
Dry mouth and blurred vision. B. Weight gain and sedation. C. Insomnia and appetite suppression. D. Akathisia and tardive dyskinesia. Answer. C. Insomnia and appetite suppression. This question assesses the practical knowledge of the most common adverse effects of stimulant medications, like methylphenidate or amphetamine, which are used to treat ADHD. The primary side effects of CNS stimulants are an increase in energy, leading to insomnia, and a decrease in appetite, leading to weight loss or appetite suppression. Dry mouth and blurred vision are commonly associated with tricyclic antidepressants, while akathisia and tardive dyskinesia are side effects of antipsychotic medications. When working with children on stimulants, the social worker should monitor growth charts and sleep patterns. Question 26. A social worker is utilizing a genogram during a family assessment. The most important function of the genogram is to
A.
Predict the future psychological problems of family members. B. Diagram the family structure and history across several generations to identify patterns. C. Determine the primary financial stressor affecting the family unit. D. Provide a written contract for intervention between the family and the social worker. Answer. B. Diagram the family structure and history across several generations to identify patterns. This question tests the specific purpose of the genogram, a core tool in family assessment. The genogram is essentially a graphical representation, or a family tree, that maps relationships, crucial events, and the structure of the family across at least 3 generations. This allows the social worker to visualize and understand intergenerational patterns and recurring issues, such as addiction or early death. The Genogram is a mapping tool, not a prediction tool or a contract. Question 27. The most challenging ethical issue for a social worker working in a small, rural community is often
A.
Managing mandated reporting requirements. B. Avoiding conflicts of interest due to lack of specialized resources. C. Maintaining professional boundaries and avoiding dual relationships. D. Ensuring client access to telehealth services. Answer. C. Maintaining professional boundaries and avoiding dual relationships. This question tests the understanding of ethical challenges unique to specific practice settings, with rural areas posing a significant risk to boundaries. In small, rural communities, social workers are likely to encounter clients in non-clinical settings, e.g., at the grocery store, school events, community gatherings, making the maintenance of strict professional boundaries and the avoidance of dual relationships significantly more difficult than in urban settings. While resource limitations are a challenge, boundary issues are the core ethical dilemma often faced in this specific environment. The social worker must carefully manage these chance encounters to preserve the professional relationship. Question 28. A client expresses a great deal of hostile energy toward their sibling, but instead of confronting the sibling, the client channels this energy into competitive running and training for a marathon. This defense mechanism is known as
A.
Displacement. B. Rationalization. C. Undoing. D. Sublimation. Answer. D. Sublimation. This question assesses knowledge of defense mechanisms, specifically the mature defense of sublimation. Sublimation involves channeling unacceptable or harmful impulses, like hostile energy, into socially acceptable and productive activities, like marathon running. Displacement is shifting feelings onto a different, less threatening target, which is not what occurred here. Sublimation is considered one of the most mature defense mechanisms because it both protects the ego and allows the energy to be used constructively. Question 29. A social worker is utilizing a family therapy approach where the primary focus is mapping the family structure, identifying boundaries, clear, rigid, or diffuse, and joining with the family system. This approach is
A.
Bowen Family Systems Theory. B. Strategic Family Therapy. C. Structural Family Therapy. D. Experiential Family Therapy. Answer. C. Structural Family Therapy. This question tests the knowledge of family therapy models, and the description strongly aligns with Salvador Minichin's structural family therapy. The core concepts of structural family therapy are identifying and addressing the family structure, mapping boundaries, disengagement, or enmeshment, and the therapist's active role in joining the family system to bring about change. Bowen focuses on differentiation of self and intergenerational patterns, while strategic therapy focuses on problem-focused directives. When the focus is on the organization of the family and the nature of its boundaries, structural family therapy is the correct answer. Question 30. During the termination phase of therapy, the client begins to miss sessions, arrives late, and expresses anger at the social worker for no apparent reason. The social worker should interpret this behavior primarily as
A.
A manifestation of a new, unassessed mental health disorder. B. The client's expression of resistance to ending the therapeutic relationship. C. A sign that the client requires a longer course of treatment. D. The social worker's failure to adequately address the client's treatment goals. Answer. B. The client's expression of resistance to ending the therapeutic relationship. This question addresses common clinical phenomena associated with the termination phase of treatment. These behaviors, missing sessions, lateness, and sudden anger, are classic manifestations of the client's emotional reaction to the impending loss of the therapeutic relationship, often termed resistance or avoidance of the ending process. While the client may need more time or have a new issue, the most direct and common interpretation is that the client is struggling with the emotional impact of termination. The social worker should address these feelings openly, asking the client about their thoughts on ending services. Question 31. A social worker is working with a client who is having trouble remembering basic facts about their life and their family's history, and the client denies that this memory loss is causing them any major difficulty. The social worker should include this information in which section of the mental status exam? Essie?
A.
Affect and mood. B. Orientation. C. Thought process. D. Memory and cognitive functioning. Answer. D. Memory and cognitive functioning. This question assesses the social worker's understanding of the components of the mental status exam. MSE. The MSE section that specifically tests the client's recall and basic knowledge, like remembering basic facts about their life and their family's history, is the memory and cognitive functioning section. Orientation focuses on person, place, and time, while affect and mood address emotional presentation. The MSE is a systematic way to observe and describe a client's current mental state. Question 32. A social worker is facilitating a community meeting to address rising homelessness. In using community organizing principles, the social worker's best initial action is to
A.
Immediately write a grant proposal to secure funding for a new shelter. B. Identify and engage Indigenous leaders and key stakeholders within the affected community. C. Conduct a formal, citywide census to determine the exact number of unhoused individuals. D. File a petition with the City Council demanding immediate policy changes. Answer. B. Identify and engage Indigenous leaders and key stakeholders within the affected community. This question tests the core principle of community organizing, emphasizing empowerment and client self-determination. The word best initial action points to the fundamental need to start where the client, the community, is, which means involving the people who are directly affected and have the most power or influence within the group. Starting with external actions like writing a grant or petitioning the city before engaging the community violates the principle of social work practice that values local knowledge and leadership. The process should begin with building relationships and identifying local strengths. Question 33. According to the Kubler-Ross model of grief, a client who frequently says, "I know I'm going to die, but if I can just live long enough to see my daughter graduate next month, I'll be at peace," is likely in which stage?
A.
Denial. B. Depression. C. Bargaining. D. Acceptance. Answer. C. Bargaining. This question assesses knowledge of the stages of grief, where the client is facing death and attempting to negotiate a temporary extension of life. The client statement contains the key element of "if I can just live long enough," which is the classic sign of the bargaining stage, where the individual tries to make a deal with a higher power or fate to postpone the inevitable. Denial is refusing to believe the reality, while acceptance is characterized by a calm, peaceful surrender to the facts. Bargaining is the stage of attempting to regain some form of control by making a conditional request. Question 34. A social worker is preparing to conduct a risk assessment for a client who recently experienced a job loss and is expressing suicidal ideation. Which of the following is the most important protective factor to identify?
A.
The client's history of managing stress successfully. B. The client's stated plan for self-harm and access to means. C. The presence of a strong social support network and family connections. D. The client's current level of depression and hopelessness. Answer. C. The presence of a strong social support network and family connections. This question tests the ability to distinguish between risk factors and protective factors in a suicide assessment. The question asks for the most important protective factor, which are elements that decrease the risk of suicide. A strong social support network provides connections, monitoring, and reasons for living, making it a critical protective factor. History of successful coping is a protective factor, but the strength of the client's current social safety net is typically considered the most immediate and critical protective element in acute risk assessment. Access to means and level of depression are risk factors, not protective factors. Question 35. A social worker is reviewing an electronic health record, EHR system that uses artificial intelligence, AI, to generate preliminary progress notes based on transcribed session data. The social worker's professional responsibility regarding the AI-generated notes is to
A.
Assume the AI notes are sufficient as they are and proceed to the next task to improve efficiency. B. Consult with an attorney to ensure the AI system meets all HIP requirements. C. Review, edit, and ultimately take full professional accountability for the accuracy and completeness of the final note. D. Only use AI notes for administrative billing purposes and continue writing all clinical notes manually. Answer. C. Review, edit, and ultimately take full professional accountability for the accuracy and completeness of the final note. This question addresses the emerging ethical standards, including 2025 updates, regarding the use of technology and AI in social work practice, emphasizing professional accountability. While AI can improve efficiency, the social worker retains the ethical and legal responsibility for the accuracy and quality of all client records, meaning the worker must review, edit, and sign off on the note. Simply assuming the AI is correct or only using it for billing is an avoidance of professional duty, and the responsibility for compliance rests with the agency, not solely the worker. A key ethical takeaway is that technology is a tool, but the social worker remains the sole responsible party for all clinical documentation,